Hi everybody. I really wanted to talk about pre-diabetes and staying healthy and looking young and being pain-free. And it's so important that I just had to make this video right now. And on the next video, I'm going to talk about this new hair. So guidelines have changed, at least in the United States, for screening patients for diabetes. So normally type 2 diabetes is the type of diabetes we're at risk for when we gain weight, we become overweight, 30 pounds extra, and then your primary doctor would test your blood sugar and screen you for diabetes. But there's new guidelines now where we are decreasing the age for screening for pre-diabetes, and I'll talk about that in a second, starting at age 30 up to age 70. And I am very on board with this, and this is so important. And I'll tell you why. I'll give you a little personal history. So I'm about to turn 55 years old here, coming up pretty soon. And I have a history of gestational diabetes with both of my pregnancies. And I was on insulin and had a wonderful OBGYN because I didn't necessarily want to be on the oral medications because we can't study babies in utero on certain medications. And I didn't want to risk taking any medication. I wouldn't even take an aspirin or a Tylenol. And I remember my OB at the time, and she was lovely. I had two different OBs, but my first one said, because I had very bad low back pain, she's like, oh, go ahead and take a Tylenol for your back pain. Well, I knew how hard Tylenol is on our liver. And I thought, well, I don't think I want to take that with my developing infant. So I opted not to take her advice, and I did not take the Tylenol. Because when you're a physician, you are the worst patient ever. I was a very non-compliant patient. So I did not take the Tylenol, nor would I take any medication. But, and I didn't end up on anything on that first pregnancy with the gestational diabetes, but okay, so that's another story. So on my second pregnancy, because I was a little bit older, I was 45 when I had my next baby. And again, gestational diabetes. But since I was older, instead of being on the oral medication my new OB offered, I opted to see if she was open to insulin, since insulin is natural and our bodies do make it, and I didn't think that would cause harm to my baby. And especially when you have a baby when you're 45, your baby is more likely to have risks. In fact, they even said I have a risk of having a baby with Down syndrome because they did a scan and saw a heart defect in the baby, but everything turned out fine, and I was on insulin and all was well. Well, fast forward to now, I do have pre-diabetes, and I say pre-diabetes and not type 2 diabetes right now is because I'm trying to keep things under control. I've kept my weight down. However, now that I'm approaching age 55, it's getting harder to keep it under control with natural measures. And one of the reasons I know is because I've been dealing with frozen shoulder, and that's when you can't lift your shoulder up all the way, and that just comes out of the blue. I'll probably do another video on that if you're interested. And then I've had a couple rashes that caused by candida, which again is common when your blood sugar's out of control. And I've had a lot of joint pain. So if you ever have that pain when you get out of bed and you're like, and the bottoms of your feet hurt and your joints hurt, yeah, if you're eating sugar, it's going to make it 100 times worse. So if you're dealing with joint pain, the first thing you want to do is cut the sugar out of your diet. Your pain will decrease dramatically because sugar causes inflammation. It glycosylates the blood gets very sticky, the red blood cells stick together, and it doesn't flow to all the areas it needs to get to. Hence why people, when they complain of blurry vision, yeah, it's thick, sticky blood from all the blood sugar not flowing to the tiny arteries inside the eye. And so a lot of diabetics will complain of change in vision or blurry vision. So I finally have decided to go on Metformin. So I'm going to be on Metformin daily, and I'll let you know if things are getting better. Sure would be a nice side effect. But I have to tell you, when you control your blood sugar, your mortality risk improves greatly. So we now know through studies that one that is put on metformin while they're borderline pre-diabetic, like almost a type 2 or a type 2 diabetic. If they're compliant with their metformin, their mortality increases, which basically means you can live a longer, healthier life. People with high blood sugar that's uncontrolled are at risk for joint pain, aging skin, wrinkles, hair loss, hence why I have very thin hair, weight gain around the abdomen, fatigue, the amount of fatigue someone with out of control blood sugar deals with. It's real. You just constantly just want to go lay down. Poor wound healing, rashes, frozen shoulder, worsening symptoms of menopause, trouble sleeping, insomnia. I mean, the list goes on, but I very much worry about the cardiovascular risk, the risk of stroke, and a type of Alzheimer's that is directly caused by diabetes. And we actually call that diabetes type 3 because the inflammation in the blood sugar literally is damaging the brain and can lead to a type of dementia that would not have occurred if the blood sugar was kept under control. So I didn't want to be on medication, but I'm going to go ahead and get on this medication because turning 55, I'm done messing around. I want to live a long, healthy life and be there for my children when they grow up. Plus, I want to still look healthy and nice. So if you don't know what to ask your doctor for, a really good test would be they can do a complete metabolic panel, and that will test your fasting blood sugar, your liver enzymes, your kidney function. It's basically almost getting like an oil checkup for like your car, except you're doing it for your body. I would ask for a hemoglobin A1C because that's looking at the last 3 months of your blood sugar, and it looks at the overall reading and then gives you a score. So then you know kind of where exactly you are at on the diabetes risk scale. An average above 126 is criteria for type 2 diabetes. Oh, the sun is really coming through, so I'll try to see if I can move my camera a little bit and improve that a little bit. And so the other test, at least that I do with my patients, so hemoglobin A1C, a fasting insulin. If I'm very concerned about pancreatic function, I'll do an amylase, a lipase, and a C-peptide. That lets us know, A, is the pancreas still making insulin, and how much is it based on the C-peptide results, or is there any pancreatitis going on? So you can get an amylase and lipase with that. Your doctor will know what to order, but you should be screened for prediabetes if you're having any of those symptoms that I talked about, especially the women that are joining my channel and that have thin hair and are perimenopausal or menopausal. We are more at risk for blood sugar issues. There's also a condition, there's two more, polycystic ovarian syndrome. That can occur with teenagers and very young women, and it can go undiagnosed many, many times. And symptoms of that, besides not managing blood sugar, would be hair loss, growing hair on the chin or the jawline, irregular periods, trouble, difficulty losing weight, or just not being able to lose weight no matter what you do. That is also treated with metformin. But there's other treatment as well, and there's other ways that we diagnose PCO. But if you have, I know most women that watch my channel are more my age, over 50, but if you do know a young person that is struggling with those symptoms, get them screened for polycystic ovarian syndrome or PCOS. And the other condition that can cause issues is metabolic syndrome. And that's the clinical picture where you have high cholesterol, high blood pressure, weight gain around the middle, and of course trouble with managing blood sugar. So that's called metabolic syndrome or syndrome X. Usually that's cured with diet, lifestyle, and weight loss, but sometimes medication is needed too. There is so much more information coming out about metformin, that it's the new anti-aging medication. It's been out for decades. It's very safe. I mean, the two big side effects would be lactic acidosis and a deficiency of B12. So when you're on that medication, you do have to supplement with B12. So those of you that are already on metformin, I hope that you are supplementing with B12 and you do know about that, because B12 not only helps us have energy, it does protect our bones Because again, when we're older, we're at risk for osteoporosis, especially in the presence of high blood sugar. So really, it was just my message to you to get screened for your blood sugar, because it can really make you feel a whole lot better, and it can help you look and feel younger as well. And it's great for the hair. So thank you for staying through to this video. I am planning on doing a live chat Friday evenings. It's either going to be 8 p.m. or 7 p.m. I'll put out a video. So if you have questions on blood sugar or labs you've had done, or, I'm not going to practice medicine over YouTube, but I'm happy to clarify something or answer a question if that's help. Thanks for watching.